Or Hey everyone, and welcome to day 23 of Thriving in the Face of Cancer. I'm your host, Chef AJ, and every day for the next 7 days, I will be talking to top doctors and other healthcare professionals, as well as people who have survived cancer, who'll be giving you insights on how you too can thrive even in the face of cancer. Today's guest is Dr. Neil Nedley, and he will be discussing anxiety in general, and specifically how to help people that have cancer with their anxiety that often comes when they're diagnosed. Please welcome Dr. Nedley. It's so good to see you.
Oh, it's good to see you, Chef AJ, and great topic.
Yeah, absolutely. I love you are such a wonderful speaker. When we've had our live conferences, people are just in awe of your presentation skills. And, we joke about this a lot that by trade, you are a board certified internal medicine doctor and GI doctor, but really all your work, at least lately, has been focusing on brain health.
Yes, well, there's quite a gut-brain connection. Even the microbiome actually has more to do with our brain than our gut. And so, being that GI doctor and internal medicine doctor, there's quite a brain connection. And since no one really is doing the work that we're doing in regards to brain health with depression and anxiety, that's one of the reasons why my wife Erica recommended, there are good doctors in other lines, but no one's doing what you're doing in mental health. And so that's why we've emphasized it more. And it's now the majority of what we do is anxiety and depression.
Yeah, and you even I hear you have like an amazing, I think is it an 18-day program called the Depression and Anxiety Recovery Program that you host at this beautiful location in Weimar.
Yeah, it's actually a 10-day program,
Oh, that's
but
better.
it can be a 17 or 18-day program. So about 80% only need 10 days and their problem is solved, and about 20% need a little longer period of time.
It's just hard to, I mean, I'm doing very well, by the way, now, but I wasn't always, especially when I was first diagnosed. But I just can't imagine somebody like me that has been an anxiety sufferer my whole life could come to a program for 10 days and be better. What kind of magic do you offer?
Well, a lot of people are skeptical are skeptical because of that. And but it is amazing. You have to experience it to really believe it. But yes, transformation occurs on a regular and routine basis in regards to the brain. And that's because we're actually dealing with the root sources behind the anxiety and depression. And once we are able to touch and reverse those, it's amazing how quickly it can get better.
Yeah. How is it different? Because I have a lot of friends that I've recommended and know people that have taken the New Start program at Weimar. How are these programs different or similar?
So the NEWSTART program is more for physical illness. So we will treat heart disease, diabetes, autoimmune disease, even certain cancers. So cancers that are lifestyle and nutrition amenable, we will accept people into the NEWSTART program. And that one is a 17, 18-day program. So that one is more known as far as the length of time. But of course, we also treat those physical diseases. I love to treat cancer as well, particularly through natural means, and that's been a strong emphasis of mine. But the mental health aspect is in a different facility at Weimar. So these programs are concurrent, and one is in what's called the Weimar Inn, the other is in the Weimar Lodge. And the Weimar Inn, we normally start on a Wednesday or Thursday, and we go through 2 weekends and end on a Monday morning. And that's the encompassing of the 10 or 11 days. And we're doing everything and also turning over every rock or stone to see what the primary causes are. And most people that come here don't realize what their primary reasons for anxiety are. They understand a little bit of it. They certainly understand their symptoms, but they may not realize that they're an undermethylator. They have a metal metabolism disorder. They may not realize how their lack of forgiveness. I know Dr. Schwelton yesterday, how their lack of forgiveness has resulted in bitterness and anger. And you can't really solve anxiety until we get to the root of those thought issues as well. So we'll look at the thought aspect as well. And of course, anxiety in general is excessive fear and worry. So it's normal to have some anxiety when you're diagnosed with cancer, for instance, because cancer is a death sentence if those cancer cells are not destroyed. But excessive fear and anxiety is actually very damaging. And we also want to have our immune system not in a fight or flight state or a panic state because that's very suppressing. We even, even COVID, you were more likely to die by far if you had anxiety versus not. And the same is true with cancer. So one of the best treatments of being able to have the comprehensive treatment for cancer is something that many natural people ignore, and that is getting to the root of anxiety as well. And that will greatly help our immune system do its work.
That's incredible. Sign me up. I mean, I should go through the program and have you film me to prove to people that how important this is. Because I've seen people like that are very, I would call them calm and emotionally stable. And then when they get a diagnosis like cancer, maybe for the first time in their life, they're experiencing intense anxiety, especially around scans. I'm in several cancer support groups, and they call it a thing, scanxiety, that these people are pretty chill, but then a few days before the scan, you know.
Yeah, exactly. So yeah, it's very important. And I don't think people recognize how much it suppresses the immune system. Now, depression we know has a lot of physical effects as well, but depression does not suppress the immune system like anxiety does. And so we don't see the connection necessarily between depression and cancer like we do with anxiety. And in regards to the immune response, nor do we see, people with depression didn't seem to have a higher death rate with COVID, but if they had anxiety, it was almost as bad as obesity. It was worse than heart disease, even diabetes. It was worse than a whole lot of comorbidities. And that's because of that immune system. And if the immune system is not good against infections, it's not going to be good against cancer either.
Yeah, I mean, I had no idea until this moment that anxiety suppressed your immune system, and that would be something very important in recovering from cancer because you want your immune system as strong as possible.
Exactly. And that's why we want that comprehensive approach. And a lot of times we're just emphasizing what we're putting into our body, but not necessarily our thought process. And so much anxiety is actually as a result of irrational and distorted thoughts. And it's very good to get to the core issue and then also the spiritual life as well because there are things. In fact, there's a text in the Bible that says, "Perfect love casts out fear," and so that's that spiritual, loving relationship that can actually cast out fear. And if we don't have fear, we don't have anxiety.
Right. And my favorite passage in the Bible is, I don't know the number, but Isaiah, where it literally says, do not panic. They literally mention panic disorder in the Bible.
365 times in the Bible, it says, "Do not be afraid." Yeah, the one for each day of the year. So 365 times, do not be afraid. And then also, there's a phrase repeated a lot, fear not, as well, will also come together in a lot of these spiritual writings. And that's for our own mental and physical health.
Yeah, I know, everyone's different. And I know some people, maybe when they're diagnosed with cancer that had faith, maybe kind of give up on their faith. But what I'm noticing, and I don't know everybody, I'm only in about 4 different cancer support groups. So that's about 8 hours a week, is the people that are the long-term survivors. And I'm meeting people 12 years, 17 years, and one 40-year survivor. What I hear from them is their faith is what got them through.
Absolutely. And I think at least partially, it's the faith helping the anxiety portion of things.
Yeah. Do you know what you call an atheist in a coffin?
I haven't heard that.
Someone who's all dressed up with no place to go. Yeah,
All right.
yeah,
Yeah.
yeah. It's interesting that you say that anxiety is a result of distorted thinking, but I feel like in the case of cancer, this is the first time my anxiety is appropriate for what's really happening.
Yeah, exactly. And so, anxiety can also be one of the causes of cancer as well. But we certainly, even if it's not a cause, because many people that suffer from cancer didn't have anxiety to begin with, even if it's not a cause, it's a very important aspect of their healing to get to the root cause of the excessive anxiety and even use some natural things that could be helpful as well.
Yeah, well, I love your natural approach, I mean, I can say this: you are a medical doctor, and I moved up here in Northern California to have you as my medical doctor because I wanted somebody that was faith-based and plant-based. Those are important things to me, and I love that you always go with the natural, thing before the med. Not that you are a doctor, you obviously give medication, but even that you recommended something because I don't take any psychiatric drugs. I tried them years ago; they didn't do well for me, but that little herb thing, Lavella, that you recommend, and I hardly ever take it, but it's funny, just like if I have something, I don't need to even need to take it, but just knowing I have something, it makes it better. You know what I mean?
Yeah, absolutely. And I wish the world would know more about that because, often they're using quotes, natural things that have benefits and significant risks. For instance, a lot of people are treating their anxiety with CBD products today. And you can't get all the THC out of CBD products. We'll have people that say, "Hey, I'm only using CBD." We use it, you urine test them and the THC lights up significantly. They haven't found a way to get that all out of there. And the THC is actually going to be a frontal lobe suppressant. It's going to add to problems. It's the addictive element as well, the tolerance that builds up. And Lavella that you just mentioned has all the benefits of marijuana, but zero risks. There's no Lavella-induced psychosis like there is with marijuana-induced psychosis. And it's a lot less expensive as well. But, humanity is always interested in trying to roll the dice or walk the tightrope of benefits versus risks. And that's why medications are so popular as well. Hey, I went to the doctor and yeah, it has all these potential risks, but it might help me. So let's go ahead and take it. But many natural healing elements only have benefits and zero risks. And if it's proven benefits and no risks, why are we ignoring these things? So I wish every marijuana dispensary would have Lavella in it, but none of them do. You will never find it in a marijuana dispensary.
No, I think I've only had to take it like 4 to 6 times in the last 3 years, and it works for panic attacks. It really does.
Yes,
And
yes.
and you are the one that told me about it.
Well, I'm glad that research, and of course I learned about it from research. A lot of these natural things, and this is kind of the the crazy thing about it. 20 plus years ago when we started our depression and anxiety recovery program, our residential program, then community program, uh, what I was doing was considered alternative medicine. In other words, the real scientific approach was the traditional medical approach. And then you could go into alternative medicine, and alternative was almost seen as non-scientific medicine. And now the tables have turned so much that even in psychiatric reviews and prestigious peer-reviewed journals, even in the psychiatric world, for instance, Lancet Psychiatry recently stated that nutrition and nutrient supplementation need to be mainstream in psychiatry. And they said there's actually more evidence for that helping the brain than the pharmaceutical approaches. Now, pharmaceutical approaches might be necessary in certain cases, but that really should be considered the alternative. We really should be going first line into things that only have benefits, don't have risks, and can get to the real problem. And we're going to solve a lot more mental health issues than just medicating it, because medicating it basically will turn into a psychiatric cripple because there are side effects of those medicines that will build up and you can relapse within a year as a result of the side effects, and you need more medicines. Then you need by the time a person comes to our program, often they're on 4 different anti-anxiety drugs and they still have severe anxiety. And this is the traditional approach that is not very effective. And then they're amazed that in 10 days, they're not only doing better, but in 20 weeks, they're now off all four of their drugs and they don't have anxiety anymore.
That's incredible that you have that kind of success rate because so many people do medicate and I think anxiety is very prevalent in this world. I mean, think about it, just things like the LA fires. I mean, we live in a world that I think provokes anxiety.
Oh, absolutely. Absolutely. And interestingly, the ones, we just finished this COVID pandemic, but the ones who were most likely to die from COVID were the ones who were glued to their TV set and were just deathly afraid of going out, et cetera. Eventually, that virus went around. It was so contagious. And those were the ones who were most likely to succumb, were the ones who weren't as worried about it when they got it. They didn't seem to suffer as much.
Yeah, well, last time I watched television was 2018, and so I don't I even when I had television, I never had the news on ever, 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 ever.
Yeah. Not much you can do about past news.
Right. Well, it's amazing that I had no idea that anxiety actually suppressed the immune system to the degree that you say it does. Do you know how the mechanism of that works? Because I would imagine for any disease a person has, not just cancer, you would not want your immune system suppressed.
Yeah, it's actually due to the lymphocytes. It's been well documented. And so you have problems with both the T and B lymphocytes. So this is more of your secondary immunity. And of course, those are what's very involved in helping to fight the cancer. But it's also involved in the primary immunity of the monocytes. So monocytes are what turn into what's called natural killer cells. Natural killer cells are actually known to be able to sniff out an abnormal cell like a cancer cell and then just come in and destroy it. And so your monocytes, if you're getting a complete blood cell count, if you want to look at your what's called your innate immunity, that's going to be the monocyte level. And we like to see that monocytes 10% or higher. And that will help your immune system. But getting rid of the anxiety itself will augment your monocyte numbers as well as their ability.
Well, let's do it because I didn't know that we were going to take this direction because so many people are like, oh, how did Chef AJ get cancer? Vegan, 47 years. Well, I just because I'm able to, I've had lots of training in theatrical training and I can do comedy. And just because people see this presentation of me, they don't really know what I've been like inside, all these years. And I have suffered from anxiety. And to think that that could be the cause is just mind blowing to me.
Yeah, it certainly could be a contributing cause. I don't think it's necessarily ever a sole cause because something had to cause that cancer to begin with. But when you have a carcinogen that causes it and then a suppressed immune system that set up for that invasive cancer.
Yeah, that's so interesting. Did you want to show any? You always have such great slides. Did you want to show any of them just to bring the point home or?
Yeah, we could go into a little more depth here as far as anxiety. Let me see if we can do this. So, anxiety disorders are the number one mental illness. A lot of times people think depression is number one, but when we add up all the anxiety disorders, there's more anxiety than there is depression in this world. And notice it's excessive worry about a variety of topics, events, or activities. It can be challenging to control and it may shift topics. This is generalized anxiety disorder. And in addition to the excessive fear or worry, you normally have at least three of these six. If you're a child, you can have the diagnosis with just one of these six. Feeling on edge or restless, fatigue, impaired focus, irritability, muscle aches and soreness. A lot of chronic pain is actually due to anxiety. We have a lot of people throwing away their pain medicines after their anxiety is taken care of here. And then difficulty sleeping. So three out of those six or more, and excessive fear or worry, and that's the diagnosis of generalized anxiety. But then panic disorder, you mentioned panic earlier. This is where you get these physical symptoms. palpitations, pounding heart or accelerated heart rate. And these things seem to come out of nowhere. You might not even be thinking an anxious thought necessarily, and panic can just come out of the blue, but it is actually due to anxiety. You can get sweating, trembling or shaking, shortness of breath or smothering, a feeling of choking, chest pain or pressure. Now, you don't have to have all of these symptoms. In order to be diagnosed with panic, you just need 4 of 13. So I've mentioned here 6 symptoms. Seventh is nausea or abdominal distress. We tend to see in the GI world a lot of nausea, abdominal pain. We do scopes, we do scans, we can't find a reason for it. And then we have them take an anxiety test and we realize, their abdominal pain is actually due to anxiety. And feeling dizzy, unsteady, lightheaded, or faint. Feelings of unreality can occur during panic where you're being detached from yourself, even what we call depersonalization or derealization. Fear of losing control or going crazy. Fear of dying, numbness or tingling sensations, chills or hot flushes. So once again, I don't know. I've had people with severe panic come here, and some of them has had as many as 12 of these symptoms. I've never had anyone with all 13, but most will have 4 or more. And so if you have panic, that's a clear sign that your immune system is also going to be affected. So we would want to get to the root cause of that. Agoraphobia. All the phobias, phobia means fear. It's the Greek word for fear. So all of the phobias actually are anxiety induced. And this is fear or excessive worry when outside your home environment, can be in crowds or in the public or open spaces, and has to have occurred at least twice before you get the diagnosis. PTSD is actually an anxiety disorder, post-traumatic stress disorder, and you'll experience or re-experience flashbacks, reliving the trauma in regards to triggers, including even the physical symptoms like racing heart rate, sweating, bad dreams, frightening thoughts. And then as a result, you'll tend to want to avoid these triggers. So staying away from places, events, or objects that are reminders of the traumatic experience, and avoiding thoughts or feelings related to the traumatic event. And then two arousal symptoms like being easily startled or feeling tense or having difficulty sleeping or angry outbursts, and at least two cognition or mood symptoms as well. So if you have those, then you are officially diagnosed with PTSD. And part of the treatment of PTSD is not just dealing with the trauma or what we call trauma therapy. There are trauma therapists. It takes a long time, by the way, normally 10 or 12 treatments of trauma therapy before we start getting to the core issue. But we also need to treat the anxiety component through biochemistry or brain biochemistry or other ways. And then another very, very common anxiety disorder is obsessive compulsive disorder. And so this is where you have either obsessions, compulsions, or both. And they can take up a lot of time of your day, usually more than an hour in regards to your obsessions. And it can cause distress or affect participation in your social activities or work responsibilities or other life events. One of the most common phobias today is what we call social phobia. This is at an all-time high, particularly we have found in younger people. The more they're on screens, the more they have social anxiety. And they're okay communicating by phone or screen or text. They don't even like phone because that's kind of too real. And so everyday interactions can cause significant anxiety, self-consciousness, and embarrassment because you fear being scrutinized or judged negatively by others. And so the fact that you're willing to have yourself filmed going through this program tells me that you don't have per se a social anxiety disorder, because the typical social anxiety, they wouldn't want to get anywhere near a camera. It leads to avoidance that can disrupt their life. Physical symptoms such as blushing or feeling your mind has gone blank will also tend to occur. And you'll notice people that avoid eye contact, not wanting to meet unfamiliar people or strangers. And a lot of people are thought to have social anxiety disorder, but it's actually social appearance anxiety. Social appearance anxiety means that you just know if someone sees you or meets you for the first time, they're going to negatively judge your appearance. And so we have a lot of college age youth that come to our program. They will go to their university cafeteria and they will run back to their room. They don't want to be seen by others. They might be okay with people that know them very well. They already have judged them, but they don't want new people seeing them because they know that they're going to be judged negatively. And of course, that's very irrational. Most people are not sitting there judging people's appearance when they first meet them per se. And and of course, there's no one that has the perfect appearance either. And so a lot of times it's actually very beautiful people that have this social appearance anxiety. And then it can result in things like anorexia and bulimia and multiple plastic surgeries and all of this, where no one's really treating the underlying social appearance anxiety, which is much more easily treated than doing surgery on people which they're never completely satisfied with their surgery, so they always want more. So, catastrophizing is a form of anxiety as well. And as one patient told me, I've heard this actually several times, the figments of my imagination are out to get me. And this is where we are just thinking the worst is going to occur. And so we call it catastrophizing. We've had people come to our program where the family was all set up for a great family vacation and they're packing the car. And then the husband with anxiety comes out and says, I'm sorry, we're not going. Why? We're all set up? We're having vacation. We're not going. Something bad is going to happen if we go. And so we're just not going to go. So the anxiety and the catastrophizing can ruin a lot of other people's lives as well. I've heard this many times as well. I'm worrying myself sick. Well, you can actually do that. You can get sick from excessive worry. Eating disorders uh, are also really part of an anxiety disorder. Bulimics have much higher social appearance anxiety, and they have excessive worry about their appearance, size, shape, or weight that can lead to these eating disorders. And so, in regards to a lot of this worry that's going on in an anxious person's mind, most of the things we worry about actually don't happen. And of course, there's something called magical worry. A magical worry is irrational, but magical worry is this idea that we must worry about it, otherwise it will happen. And so we don't stop things by worrying about them. That's not going to produce any positive effect. And so the question would be, am I worrying to distract myself from something that is deeper that I don't want to reflect on? Often that is what is happening in regards to all of these magical worries. And of course, the complications of anxiety are many. Insomnia. We have many people that have depression, but it actually was driven by the anxiety. When anxiety gets very severe, you are going to get depressed over it. Substance misuse occurs, self-harm can occur, and digestive bowel problems, headaches, many migraines are actually due to an underlying anxiety. As we mentioned, chronic pain, social isolation, and problems functioning at school, work, or family. And then we also mentioned the suppressed immune system, which has to do with cancer and infections. This was a study that actually the CDC did. The strongest risk factor for COVID death outside of obesity was anxiety, and it was almost as high. Some thin people were dying from COVID, and it wasn't their obesity, and they didn't have heart disease, they didn't have these other things, but it was their anxiety suppressing their immune system. Anxiety was even more so than diabetes. Diabetes was number three, and patients with multiple conditions were number four. So, in general, if you talk to a doctor or a psychiatrist, they will tell you what's more difficult to treat. We know depression is difficult to treat, but they will tell you anxiety is much more difficult to treat. It normally requires double the doses. We actually treat it with antidepressants as well, but it requires much higher doses than typical antidepressant doses. And thus you have more side effects, and it's known to be far less likely to resolve. So many people think they just have to suffer from their anxiety for life. But when a person comes to us, we are going to start looking for the causes. Anxiety does not come without a cause. Excessive fear and anxiety does have underlying causes that can be addressed. And some of these can be genetic causes. If you had anxiety in your family beforehand, if someone has OCD, for instance, you're more likely to suffer from OCD. And so we actually look at the genes when people come to our program. We are going to look at their genetic setup. Now, genetics is never enough to explain it all by itself. Anxiety is a multifactorial disease. It is never a sole cause. Usually there's four different categories of causes involved, but if you have a genetic hit and you might have experienced trauma growing up, or you have adverse childhood experiences you're growing up, you only have two more categories of causes that can set you off. And it might be that cancer diagnosis that puts you from the three over into four, and now your immune system is suppressed. And so we actually look at the genetics. A lot of people say, well, what can you do about genetics? Well, there's a lot that we can do about genetics today because of what's called epigenetics. And so we've had people with particularly a gene called undermethylation, which is very much associated with anxiety. And we can put them on a particular lifestyle or nutrition program or maybe a directed supplement, and their mutated gene will be totally inactivated. And so this is wonderful to find out. And we can actually measure it. We can measure the pre and post. This is what your gene was doing before you got on this nutrition and lifestyle approach or this cognitive approach. And this is what it is now, where the genetic mutation is no longer active. So we actually look for those genetic mutations. We look for the effects. So we're doing epigenetic testing as well. And then in 6 weeks, often, they'll be on the program during the 10 days, but they'll continue these things that are going to be helpful in 6 weeks. We'll remeasure their blood work and we'll find out that it's much better. Or if not, then we can tweak it some more so that it completely resolves. Our goal is biochemical perfection in 20 weeks or less in the brain. Attachment issues can cause anxiety. If you were raised in a certain way, we can have avoidance attachment disorder. There's something called an anxious attachment disorder. And it has to do with how mom and dad raised us and our relationships and those sorts of things. That can be a setup. But that also can be treated, particularly in the therapeutic aspect and the what's called cognitive behavioral therapy. Other adverse childhood events, even lack of light. You know, when you're up in Alaska in the wintertime, many people suffer from depression and anxiety because they already have 3 hits and now their lack of light is the 4th hit. And so they actually need to have a light box or a certain light that can be helpful for them. By the way, there's 2 types of light that are helpful for us, particularly the blue light in the morning. The blue sky helps us to make more serotonin, which helps us not to be as irritable. And it also can help panic. But also the infrared. Infrared light, you can't see it, but it's present from sun up to sundown, and it actually penetrates the brain. Infrared light has been shown to be very helpful for anxiety disorders. So just getting outside and experiencing sunlight. Now, infrared doesn't go through clouds. So if it's a cloudy day, you're not getting the infrared. But on those non-cloudy days, or when you can see the sun up or sun set, get out there and experience some of the infrared benefits for your brain. The sleep-wake cycle. If you have a circadian rhythm hit, that can bring about anxiety. So lack of sleep, and particularly our bodies work better with early to bed, early to rise. There's a lot of addictions that lead to anxiety, both substance addictions as well as non-substance addictions. So we address those as well. Some of those might be food addictions. And then there can be nutritional causes. If we don't have enough antioxidants on board, if we don't have enough folate, we're not going to be able to make serotonin. If we don't have enough B12, we're not going to be able to make adequate amounts of serotonin. And so we look at all of these things. We're measuring people's different vitamin levels. We're measuring their epigenetics. We're looking for every contributing factor for their anxiety because that's how we get the amazing transformation that we're known for is by finding those causes and then reversing those causes. Even sexual behaviors can result in anxiety. Adult traumas and tension in relationships can. And then there's also spiritual aspects. And in our program, it's a non-sectarian program. So we have Jews, we have Muslims, we have Buddhists, we have Christians, we have atheists, we have agnostics, we have people from all walks of life that come through our program, but we call it non-sectarian because we go through spiritual principles that no matter what your background is, it can help strengthen your frontal lobe. There's something called neuroimmunology, and you can be very healthy. So we have some people who try to state, um, I'm not a spiritual person, I'm an atheist. I don't want to go to these meetings that center in on the analytical and the spiritual. But we tell them to go there and see what they can agree with. And no one has been disappointed after doing that. And even the atheists come away smiling and saying, you know what, I can adopt this and this is going to be able to help my brain. And so you'll be comfortable no matter what your background is there. So regards to genetics, if you're more obsessive or controlling, if you have a calm exterior but a tense interior, this is where a lot of people think, hey, this person's not anxious at all. But once they get to know them, they realize there's a lot of anxiety inside. Chances are they are an undermethylator. About 38% of our anxiety patients are undermethylators. And so that means they have a hard time adding a methyl group to make the final step to make serotonin and also to make dopamine. And so it can be helped by things like inositol. The anxiety portion of undermethylation is helped by inositol. It can be helped by S-adenosylmethionine and even saffron. And so these are things that we can measure before and after to make sure that we've done things right. These people will tend to respond to SSRIs in high doses, but they have to tolerate those side effects. And those side effects can actually take away those SSRIs in high doses, take away your joy in life. So you have more apathy, you have more of an I don't care attitude. You may not have crying spells. And if you don't care, you might not be as anxious. But in reality, you are, it's a mixed bag. But when we solve it through natural means, vast majority of the time, you're going to have only positive effects, no side effects, and you don't have to worry about relapse because many people with anxiety, the SSRI will help for a year, but now they're back into it again because by design, if you notice, it's called selective serotonin reuptake inhibitor. How is it getting your serotonin activity? It is actually doing that by plugging the reuptake channels. Yes, there's more serotonin in the synapse, but there's less serotonin going back into the releasing neuron. It takes over 1 million ATP to create a serotonin molecule. So what does that mean? We need more brain energy to try to replenish that serotonin. And this is why many people have brain fog, fatigue, those sorts of things, and why they relapse because there was a shortage of serotonin to begin with due to the undermethylation. And now there's a greater shortage in the neuron because you've not allowed any of that serotonin to be vacuumed back up into the releasing neuron to be used again. And so this is that psychiatric cripple, approach where the person is now tied to their doctor in regards to multiple doses, multiple medicines, those sorts of things. And no one has asked the question, why was this patient not making enough serotonin to begin with? Maybe we can fix that. And that is actually more easily and more naturally fixed than prescribing a drug. And then you get a win-win situation. Light therapy also has been shown to help under methylation. Cognitive behavioral therapy can help as well. But some people are actually over-methylators. If you're making too much serotonin, you will also have anxiety. Um, these people, if they're making enough serotonin, they're more naturally empathetic, even for those they don't know. Our typical over-methylator, they will tell us that when they're out there cutting their lawn, they're going to cut their neighbor's lawn too if their neighbor needs it because they just feel bad for their neighbor. They're more naturally empathetic individuals, but they can have very high anxiety. They tend to be more artistic or musical or creative. So these are individuals that can be really contribute to society due to their creativity, but they have high labile anxiety. That means at times they seem to be okay, but then there's other times where they're triggered and it really sets off. And they can also have some hyperactivity. And many people that are sensitive to all these types of foods, it's not the foods that are the problem, it's the overmethylation. So we will often be able to fix the overmethylation, and now all of a sudden they can eat all these foods that they thought they were sensitive to. Uh, they can they tend to have insomnia, but if you give these people SSRIs, they're worse in 3 days. They won't stay on them because they don't need them. They're making plenty of serotonin, and now the SSRIs are producing too much serotonin activity. However, they tend to like the benzos, and unfortunately, those benzos are also going to set them up for issue. They can feel like they're at peace with the world, but when they first take them, so they think I must have had a Xanax deficiency, but then their GABA manufacturing plant's going to be shut down if they take benzos for more than a month. And now they're in trouble. And so we get a lot of those. In fact, our program is very well. It's been even we've even published a study in the scientific literature about how easily we're able to get people off of benzos because we can get to the core issue of their anxiety. And so we treat this differently. These are some of the natural ways of treating overmethylation that I have listed there. Then there's other genetics. I won't go into all of these genetic issues, but this one is also very common. About 20% of our patients have this. And this results them in an imbalance in their brain where they have too much norepinephrine. This is a cousin of adrenaline and not enough dopamine. Dopamine is your motivator, and it also helps you to enjoy the usual activities of life. So you're not enjoying those usual activities and you have adrenaline circulating around. So strong tendency for anxiety, worry, and panic, and decreased joy of life and simple pleasures. And migraines often are induced by this, as well as hormonal depression. If you have premenstrual dysphoria, if you have postpartum depression, chances are you were set up due to this genetic issue. And we can also get rid of this genetic issue through natural ways. And it's pretty amazing. Very gratifying for me to treat a patient who had postpartum depression and anxiety. And now when we treat this, they can have future kids. Some women have refused to have kids because their postpartum depression is so severe. And they're still young and reproductive. And when they find this, they realize I can have children again. And I just saw two this last week that came back after having children and said, I had no postpartum depression, no postpartum anxiety. Things were wonderful. I'm doing so great mothering this child and the other ones that I've had. And just amazing how natural things could have solved that. Then there's other issues as well. Anxious attachment disorder. I won't go into too many details there, but I did want to uh, also talk about fortune telling error. This is where a lot of anxious people get into is the doom and gloom, pessimism, negative self-fulfilling prophecies, and even suicidal thoughts are part of a fortune teller error. Jumping to conclusions, and it's a strain on relationships. And so this is treated with a biochemical approach. We always have to treat fortune teller error with a biochemical approach more Getting more serotonin activity might be the issue. And but in addition, it has to include the cognitive behavioral therapy where we create accurate new pathways in the brain. And so these calamitous thoughts, if I go over this bridge, it will collapse. We have people who have phobias about going over bridges. We have had a doctor in our program. He would drive 45 minutes out of his way to work and home from work so he wouldn't have to go over a bridge. And and it was due to the combination of the software of the brain and the hardware of the brain. Other calamitous thoughts, this project will turn out horribly. My career is finished. I'll never recover. I'll never find anyone to love me. And so, if you're finding that you're worrying about a lot of things that never even happen, it's important to recognize those cognitions as fortune teller errors. It's better to remember the good outcomes and imagine the expected outcomes instead. And so, this is one of the core aspects of anxiety. Anxiety is actually due to a runaway imagination. To treat anxiety, we have to help the person develop a skillful imagination. And a skillful imagination is a potent stress reliever. Let me give you an example. For instance, someone who is going up a ski lift. We live here close to Lake Tahoe, so there's more ski resorts around Tahoe than any other place in the world. There's so many of them, you can't even count them all, it seems. But when you're going up, you see these cliffs, these huge rocks, these boulders, these canyons. And if you're looking at all that, you're realizing I could kill myself going down this way. I could injure myself for life. This could be very anxiety producing as you're going up the chairlift. And if you start looking towards those things as you get off the chairlift and start your ski run, you're going to actually move your skis towards those things. And so it's far better to have a skillful imagination, staying on the actual ski lane and not even thinking about those cliffs and boulders and those sorts of things. And you can have a very joyful, wonderful experience skiing. And so that's an example of how we would turn a runaway imagination into a skillful imagination. It may not have anything to do with skiing, but it's an example that many people can help understand. And then that spiritual aspect of things is also important. There's a phrase in spiritual treatments: set your affections on things above. The average person has 80% of their thoughts negative, and 95% of their negative thoughts are repetitive. And so studies have shown to really help anxiety, we need to have it go the other way. How much of the other way? Not as much as, almost as much, but not as much as the other way. Studies have shown if 75% of your thoughts are positive to negative, in other words, a 3-to-1 ratio, your anxiety is going to get better significantly. And we can do that even in rational ways. And so we need to change it away from 80% negative to 75% positive. And of course, the biochemical and natural approach can help as well. But that spiritual aspect is also very important. So I don't know how much more time we have.
This
Um,
is a wonderful lecture. I've never heard this before. You can have as much time as you want, Dr. Nedley. It's really up to you. I'm learning so much. I take it you've given this talk before because it's amazing.
Yes, yeah, I have given the talk a time or two. But yeah, I know your show only lasts so long, but this is what you were
I
talking
don't
about.
think you've ever watched it then when Dr. McDougall's on because he usually went about 3 to 4 hours routinely.
Okay. Yeah, I
Yeah.
won't be able to go that long today, but I can go a few more minutes. Some of the general treatment measures, Selexon. This is the molecule that's in lavender oil that you have noticed a benefit from as well. And Selexon was actually tried against lorazepam Lorazepam is a benzo, and it showed the same anxiety relieving properties as a 1/4 milligram of lorazepam, but with no frontal lobe suppression. For instance, if you take lorazepam because you have test anxiety, you'll feel better about the test, but you'll do worse on the test. You take Selexon if you have test anxiety, and you'll do better on the test because it gets rid of the anxiety, but it doesn't suppress the frontal lobe, so you can still problem solve and you can still be highly effective. Actually, I think I just told you the opposite earlier. I mentioned do not be afraid was 365 times. That's 50 times. 365 times it says fear not. So that one is more common. And it appears that fear is not to be part of the life of the follower of God. So we want to have that spiritual connection. And the Bible does say fear God, but that's in a different sense. It's more of a love and respect is what that means. So, secret to avoid anxiety and worry. Sometimes we have to tell people it's not to become so personally involved in your own life. When you're focusing in on all of your personal involvement in your own life, it tends to bring about anxiety. And of course, letting God become personally involved in your own life, however that looks like, and our spiritual counselor is very good in helping you to do that in your own belief system. And of course, that is much better. There's a serenity prayer that has also been shown to be helpful. God grant me the serenity to accept the things I cannot change, courage to change the things I can, and the wisdom to know the difference. And so this is something that can be very helpful. Some things in life we cannot change. And to be worrying about changing those is not going to be helpful. But if we could have the wisdom to know the difference and make the changes that are necessary, because change is necessary if we're going to get rid of anxiety. But these are changes that we can make with the help of professionals and others to actually get to the core issues of the anxiety. So, yeah, this is Dr. Harold Koenig's study on the spiritual aspect and immune functioning. Large and growing volume of research now documents the benefits of religious faith on immune functioning and vulnerability to infection, viral infection in particular. And so it's associated with a reduction in the pro-inflammatory cytokine levels, which can actually bring about cancer, and an increase in immune functions necessary. So, yeah, we could go into some of our data, what happens with a comprehensive approach to anxiety. It's pretty amazing what happens here in as little as a few days. And of course, every patient that comes through that allows us to, we document their before and after results. We're actually very transparent with those results. Some people will ask, well, uh, what about comparison with another place that I can go? I don't know of any of these other places that document their before and after results, and the traditional approaches certainly don't do that except in peer-reviewed trials. But we're very upfront with our before and after approaches and also our 20-week approaches. We're even more concerned about 20 weeks post-program than 10 days post-program. A lot of people say, well, yeah, you might make me better in 10 days because you're with me the whole time and your staff and all of that. But we're just helping you get on the approach and program that's going to give you long-term success. So,
Wow.
any questions at all?
Actually, yes, I don't have very good handwriting, but I did write some things down. And one of the things I wanted to ask you, Dr. Nedley, because you talked about psych meds, did you ever read the book Anatomy of an Epidemic by Whitaker?
I perused it. Yeah, now there's a different Whitaker. Is this the Whitaker from Temple University?
I don't know where he's from, Robert Whitaker, where he talks about the history of psychiatric medications.
Oh, yes. Yeah. No, I'm familiar with Robert Whitaker. I've heard him speak. I have all of his slides. Yeah, he's onto something, and he's accurate in his analysis. In fact, I've had to refer a number of people that think medicines are the answer to all of the mental health issues. And when they see those effects and side effects, they're kind of shocked, but they're well documented and in the peer-reviewed literature, but they're often ignored.
Because I thought he'd probably be a great speaker for your summit. Because this is January and you're running one of your programs right now, but would you like to talk a little bit about the fabulous summit that you have every March?
Yeah, absolutely. Thanks for asking. So, March, it's normally when spring break at Weimar University, but March 13 through 16 this year, we have an emotional intelligence summit. It's open to the entire public, and we have speakers from all over the world that come that are experts in different areas of mental health. Um, and so we also deal with the nutrition part. This particular conference is centered in on relationships. So if you go to eqsummit.org, I think you'll be able to see the lineup there. But we have Dr. Kaliova. I don't know if you've had her on your
I've
show
had her, I've
before.
been every summit I've ever had from GI health to weight loss. She has been a speaker. She's fabulous.
Okay. Yeah. Well, she's coming. I think it'll be her first time to Weimar University, but she's going to particularly talk about the things that have a mental health component from the Physicians Committee for Responsible Medicine. We also have some very great speakers in regards to the core aspect, in regards to even the workplace relationships. We have, in fact, one person that I just like to put a little plug in, Dr. Brian Mears. Speaking of mental health, Dr. Brian Mears himself was a nurse anesthetist, doctorate of nurse anesthesia, and his wife was as well. They were doing very well, but they adopted 7 kids at the same time from his sister-in-law, who was a gambler who couldn't raise them, and they were being raised in a van, in Las Vegas. And so they inherited 7 mental health problems, all from teenage years down to as young as 2. So they started accessing the mental health system, and he saw how problematic it was and how difficult it was to get into the mental health people who were very good, and then how they wouldn't communicate with the other providers and all of that. And so he decided himself he was going to become a doctorate of psychiatric nurse practitioner. And so he started his own clinic in Arkansas, and that clinic has now exploded into almost half of people in the state of Arkansas with mental health issues now go to one of his clinics. And he's totally transformed how psychiatry is done. And he did it on the basis of good science, but also workplace relationships. His staff are well paid, but they're doing great in regards to mental health. I actually do continuing medical education for his clinic, so they're very much have a natural approach. And he's going to show how the centering in on relationships transformed mental health in the state of Arkansas. And now he's starting out in other states as well. And so that's just one of many aspects you can get to the EQ Summit part. It starts at Thursday noon to a Sunday noon. So it'll take a portion of a weekend and a little bit before, but I would encourage you to come Wednesday morning. Wednesday morning, we have a pre-summit. Wednesday and Thursday, you can get trained to actually run community depression and anxiety recovery programs in your local community. So this is an outpatient approach, and you don't have to be a doctor or a nurse, although many doctors and nurses come to our summit. They get continuing medical education, and so it can help their careers and keep up with the latest in the scientific literature. But many of our people are just interested, lay people interested in mental health. They might have a relative with a mental health issue. They might have a mental health issue themselves, and they just want to see the latest on how we can get to these core issues and solve them. So, yeah, I would encourage you to come. The students won't be here because it's spring break. We can't actually hold it at Weimar University when the students are here because the cafeteria is overtaxed, but we'll have about 300 people at the summit, and we would enjoy having any of your audience sign up for this.
Well, I might sign up myself, and I'm going to put a link below. And I just looked it up, and it looks like the pre-training is on March 13th, which is a Wednesday, and then the summit is, well, that's the 12th, and then the summit would be the 13th through the 15th, the 16th.
Yes. Yeah.
And we'll
And
have a link to
we'll
that.
have some nice plant-based menu for you here
Oh
as
my
well.
God. Well, let me just say, and I'm not, I mean, I have hosted a conference at Weimar. The food is amazing there. You will not be disappointed. Delicious whole food, plant-based food, just the way we like it. So we'll definitely have a link to that and also a link to the next programs whenever you have them. Because how often do you run the depression and anxiety
We
program?
run them about every month. So as you mentioned, we're in the middle of one right now in January. February, we'll be running another one towards early to mid-February. I don't have the exact dates, but I could get those for you
Yes,
for the
we want to
year.
make sure they're in the show notes. And I know people are going to ask, does insurance help at all with these kind of programs?
It helps a little, but typical insurance is not very good for mental health programs like this. And so most people have to spend it out of pocket. But we also have an organization called Southern Missionary Society that helps support those that are in need that can't afford it. And if you can connect people who want to donate to that, about half of our patients don't have the money to come through it, but they've had gracious others that they might know that donated to help them get through the program.
Great. Give me that link. The more links, the better. Thank you. You know, you mentioned that I took these notes. You said that most of the things that people worry about never happen. And I was joking, and you know Dr. Doug Lyle, he's my friend, and I also see him occasionally for mental health sessions. And you know, I said to him, it's like everything that I talked to you about the last 15 years, like never, all the things I worried about never happened, but I never actually worried about getting cancer, and that actually happened. You know,
Yeah,
now I
yeah,
feel like I actually have something legitimately to really worry about, you know?
sure. Yeah.
Yeah. So
Understandable.
yeah,
Yeah.
yeah. But the weird thing is since telling people about it, it's like really lowered my anxiety, coming out, if you will, revealing it. Because, you know, I went 2.5 years suffering in silence. And now that I shared it with people, it's just gotten so much better.
Yes. I think it is important. Our relationships are important and you have a wonderful relationship with all of your followers as well. And so having them being willing enough and care enough to go through this journey with you will definitely be helpful for you.
Yeah. Well, thank you. You know, so many people medicate their anxiety and maybe depression too, not necessarily with like psychiatric drugs, but so many people, like you had mentioned, CBT, but even things that we think of as benign, like, well, not you necessarily, but coffee, alcohol, chocolate, all those things can affect anxiety and for some people in a negative way.
Yeah. No, absolutely. Yeah, we address all of those things. Some of those are pretty common, and we have a lot of anxiety patients who are chocoholics. They actually are using it to self-medicate for their anxiety and depression. But fortunately, they're able to, once we get to the core issue, they're not going to feel the need for chocolate anymore.
Yeah. And carob is really great. And you allow that. And that's delicious, by the way.
Yeah, and it's naturally sweet. One of the advantages of carob is you don't have to dump sugar and fat in it to make it palatable.
Yeah.
Cocoa by itself is pretty bitter and not very palatable. So we have to, add all of this saturated fat and add all of this sugar in it, and that's one of the major risks of eating chocolate. It's not so much the cocoa, it's the other things that are coming with
Yeah.
it.
I have a new recipe and I haven't filmed it on my channel, but I'm going to bring it to you. I don't I call them carob cuties and they're low fat. They're made with oats and they're made with dates and they're made with carob powder and goji berries and a little vanilla and that's it. And they're delicious.
Nice.
I'm going to bring
Yeah.
you some. They're my favorite thing. And I also
Okay.
make them into little donut shapes, so I call them faux nuts. So I'm going to bring you some of those. You know, it's
Well, thank
interesting.
you.
Oh, I think you'll like them. I think I must not be an overmethylator because you said overmethylators tend to like benzos, and I tried those once. They were given to me for when I got panic disorder. I hated the feeling of it. I really did not like
Okay.
it at all. I did not like the feeling
Yeah.
of those drugs. Yeah.
Well, that's good. I wish more people didn't like the feeling of those drugs because after 30 days, they all regret being on them and they're
Yeah.
totally dependent.
I didn't like the feeling of any drugs that I ever tried, to be honest. I mean, meaning like psych drugs and those, or I don't drink. I tried alcohol once in college. I hated the feeling, so I guess I'm lucky that way. So
Yeah.
yeah, that's
Yeah.
so. This has just been wonderful. Thank you so much for this very important topic because I think it will help people, even people that maybe don't have a chronic or a debilitating disease, to know a little bit more about anxiety and maybe finding the root cause because I think so many people just aren't looking, you know?
It's true. Very true. And a lot of people think they just have to put up with this for the rest of their life. They don't know that healing is available right around the corner.
Yeah, well, thank you. How did you get so interested into this?
Well, first of all, because it has become so common, and I was seeing depression and anxiety every day, even though I was not a psychiatrist. I was seeing it every day in the GI world, internal medicine world. And when you're seeing something that's common, I realized I needed to become an expert in that area. And so I actually took some time to really study it out because I realized the treatments were inadequate. These people were strung on for life. And so, as an internal medicine doctor, I approached it a little different. Psychiatry, they just go into diagnosis and then treatment. Where internal medicine, we look for the root cause of the disease. And so I started to do research and found over 100 causes of anxiety. And that means we can now search for those 100 underlying causes. And as I mentioned, usually there's four causes or more combined. And once we found those causes and worked on reversing the causes, that's when I was hoping to find something as good as medicine. I had no idea that putting this together would be far better than any medicine or combination of medicines on the planet. And it's been very gratifying work. And when you're able to do that for people, you want to keep doing it.
I can only imagine. Have you written a book specifically about this?
There is a book called Depression: The Way Out. I need to write one, Anxiety: The Way Out, but a lot of the principles are the same there. And then there's also a book on the cognitive part of things called The Lost Art of Thinking. And that gets to the software of the brain to help us with anxiety that way.
That is amazing. I look forward to that book. And I want to mention to people if they do go to the Depression Anxiety Program or the New Start program, or even just attend the EQ Summit, Weimar is such a beautiful place. It's just it's out in nature. You can hike. They have this adorable store called the Weimar where you can buy the best granola ever. And so I just hope they'll get a chance to visit.
Thank you very much, Chef AJ. You're
Oh my
very
gosh.
kind. And
Well, Dr. Nedley, thank you so much. But I do have one question since this is Thriving in the Face of Cancer Month. And what message of hope would you share with somebody that's currently facing a cancer diagnosis?
there is hope. There is hope when we get to the root cause of the cancer. And if it's part of if anxiety is part of that equation, we can also get to the root cause of anxiety, and your outcomes will improve. And even if you end up succumbing to cancer, you can become a much more powerful, positive influence to your family and friends before you succumb. I know that's not what we're wanting. We're wanting to be totally cured, but cancer does kill some people, regardless of what happens. But there is definitely hope.
And you have seen people get better, right?
Oh, most of the time,
Nice.
the vast majority of the time, we see them improve.
Great. Thank you so much. And thanks all of you for watching day 23 of Thriving in the Face of Cancer. I want you to know that wherever you are in your cancer journey, as long as you're still breathing, I believe there's still hope, and you too can thrive even in the face of cancer. Please tune in tomorrow at 11 a.m. Pacific time for day 24 with guest Victoria Moran. Thank you so much, everyone. Take care.